Ever been halfway through a wisdom tooth extraction and suddenly a tooth breaks? The root piece says, "Bye, I'm staying in the socket," and you're there frozen with suction in one hand, forceps in the other, and the self doubt in your soul. Welcome to the real world dentistry. Not every case is a seminar demo. Today, we'll talk about what to do when a procedure fails midway, how to manage the clinical mess and the emotional stress, and how to stay confident even when the root fragment doesn't let go. These are everyday issues we don't admit on Instagram. Fractured crown during extraction, root tips breaks and remain lodged deep, excessive bleeding mid procedure, instrument separation during RCT, perforation or sudden patient discomfort. You think it's just you? No, it's everyone. Even when your dental idol has had an oops moment under the microscope. Here's your go to protocol when things go south mid procedure. First is you have to stay calm and assess before acting. Don't force or continue aggressively, that's where trauma begins. Retract, irrigate, and reassess. Ask yourself, is this the mechanical issue, the anatomical barrier, or a lack of access? Second is you have to take an IOPA, especially when a root tip breaks or visibility is compromised. Locate, is the fragment near the sinus, close to inferior endovenous nerve, accessible with flap or surgical burr? Knowing this avoids unnecessary trauma. Third is know when to continue versus refer. Proceed if it's visible. No risk to nerves or sinus. You're confident and equipped. Refer if patient is distressed. Bleeding impairs vision. Root tip is dangerously close to anatomical structures. You don't have a surgical handpiece or experience. Referring isn't a failure, it's a smart judgment. Fourth is communicate professionally with patient. Do not say tooth andar reh gaya. Say a small part of the tooth or root is deep and being closely monitored. It's a non scenario and we have two safe options from here. Then you offer option A, monitor, option B, surgical retrieval or referral. Always document in records, radiographs, instructions, consent, update, write what you explained. What if you leave the root fragment? Only if it is less than 3 mm in size or no signs of infection, not close to